You're watching CTOM TV. Knowledge is power.
They've been designed to target specific mutations in you, and they can be given through pill form or intravenous. A lot of times these drugs are what we call tyrosine kinase inhibitors, and they interfere with what's called the AT-rich domain of a tyrosine kinase domain, which is basically the activation area of the gene that turns it on and off. So typically these drugs have less side effects than standard care, and obviously they can lead to longer survivals in most cases. So once again, targeted therapies, they seek out your mutated cells and only target them. So off-label drugs, basically an off-label drug is a drug that was designed for BRAF mutations in melanoma. It's been used, the clinical trial showed it's beneficial in melanoma, but now we have a colon cancer patient with a BRAF mutation. Is that drug going to work in them too? Well, often that's the case. However, you have to do it a little differently. So for example, if you were to use a BRAF inhibitor in a patient that had a BRAF mutation in a colon cancer, it's a different type of cell. So in other words, you have to combine it with another pathway inhibitor. And that's typically going to be a MEK inhibitor as well, and an EGFR inhibitor, because unlike the melanoma cells, colon cells have an active EGFR for the most part, epidermal growth factor receptor. And so you have to add a third drug with that BRAF inhibitor. So basically off-label is saying, using a drug that targets a specific mutation that was first identified in one type of cancer, and now we're finding it in another cancer. And so this is a pretty important thing. One of the biggest problems in oncology right now is most oncologists are specialists. They'll do one type of cancer, or gynecological cancers or breast cancers. So therefore, they won't really know what's going on in other types of cancers, and that's a huge problem. Because there could be the perfect drug in a prostate cancer patient. They could have, a breast cancer doctor could have a patient with high androgen receptor overexpression, and therefore a prostate cancer drug would be really good for them. But if they didn't know about androgen receptors in breast cancers, they're not going to know that that particular drug is going to be beneficial for them. So it's really important to have a specialist that deals with all types of cancers. And typically they're referred to as community oncologists, but someone who does not focus on one type of cancer, they're going to have, if they only focus on one type of cancer, they're going to have limitations. They're not going to know how drugs from other types of cancers could benefit you. And that's a constantly changing field. So off-label drug knowledge is really important.
Thank you for watching CTOM TV. Subscribe below and stay informed.